Vargolamudan. Today in the session, we are going to discuss the science behind meditation, especially with respect to our Vedantri Maharishi principles. We will look into various research articles available and various publications done in this field. And we will try to focus on how we can use this to connect to absolute space. So, Maharishi's meditation and principles of Sky Yoga is a science of inner travel. And he has given us 9 comprehensive meditation methods. Maharishi says meditation is the practice to commune the consciousness with the vast universe. And specific meditative practices will shift the frequency of a person from the finite body to the infinite absolute. We all know the frequency of the mind waves from beta to delta. We have discussed this few times. Mainly, the words what we use in explaining the meditation are like Kundalini, which is the fundamental life force energy. And it is not a magic, it's a real life force. Once you start practicing, you will be able to feel it and see the improvement. And biomagnetism is the electric energy which is deriving the neurological processes and bridge between the body and consciousness. Slowly, as you practice the meditation, you will feel the mind as a wave, and meditation is the art of calming the wave and making the ocean still. And we understand that beta is the normal waves in our day-to-day life, 14 to 40, while alpha is 8 to 13, which is like giving some attentive attention in a classroom, for example, while theta is a deep meditation of 4 to 7, which can be reached quite quickly in small meditations which we do before the sessions like today's one, and delta, which is a very divine state and merging with absolute space, which happens with a frequency of 1 to 3, which will happen only with prolonged practice and long duration of practice. One of the key meditative practice which we used to initiate, especially in Sky Yoga, is the Agna meditation, which is the awakening meditation. Anatomically or medically, it is related to the pituitary gland, which is our master gland. And the initiation in Sky is by using Sparisha Diksha, which means the master will touch our Agna and initiate us. It shifts the mind from beta to alpha frequency, quite early stage, and it develops constant awareness and willpower. It results in harmonizing the subconscious mind and reduces the adamant nature of unreasonable anger. We can see people who are performing Agna meditation quite periodically and continuously becoming more calmer. Maharishi stresses on Shanti meditation to be taught on the same day of Agna meditation, because Agna meditation results in the biomagnetic energy to get risen to the higher chakras, which in some individuals can cause an imbalance of headache, fever, and the headache sometimes will be quite troublesome. And so these people who are undergoing the Diksha should learn the Shanti Yoga at the same time, so that if there is any headache or untoward side effects, they can do the Shanti Yoga to relax the biomagnetic energy and spread it to the rest of the body. And even for normal practitioners, Maharishi advises Shanti Yoga at least once in a week and mostly on Fridays. The focus of Shanti Yoga is to relax the biomagnetic energy rather than keeping on focusing it in the higher chakras. So we focus on the Mooladhara or the root chakra. And Agna generates lot of intensity, while Shanti acts as a cooling system to prevent the headache and insomnia. It transforms the physical energy into the mental energy. It regulates the blood pressure and temperature, cues indigestion, chronic pain, creates a kind of a good balance. It's a very important protocol. In my practices, especially in England, we have seen some people who had Agna initiation and overzealously performing for few weeks without proper Shanti meditation, resulting in headache and side effects, where the master needs to travel few hours to reach the person to help with Shanti Yoga and relaxation. Because when the side effects happen, sometimes the person may not be able to even travel back to the master. In UK, we have only 4 or 5 stations for the whole country. And next is the Turiya meditation, which is also known as the crown meditation, where the focus is on the pineal gland. It's known as Sarasarahara. The concept is to transition from the body consciousness to the soul consciousness, and it acts again by biomagnetism, which activates the dormant brain chambers. It literally eradicates the karmic imprints. Maybe we'll do a separate session on karma, which is again quite a nice deep topic, how meditation works to come out of karmic imprints, etc. And since Turiya meditation is outside the body, almost at the level of the crown, it takes you away from that body mind association and indirectly the karmic imprints. It gives an access to the astral body. It heightens intuition and ability to bless. People who are performing Turiya meditation quite periodically were able to intuitively guess what's going to happen, and once they keep an eye on that intuition, they can find that a lot of times it's true, and the percentage of truthfulness in the intuition becomes higher as one performs the Turiya meditation periodically. The next from Maharishi is a Panchendriya meditation, which we had today. Tarunji has given us a very nice Panchendriya meditation where we focus on the perception, which are the 5 windows through which our soul communicates with the world. Skin, pressure, we can focus on the hand, for example, or skin in any part of the body. Mouth for taste, nose for smell, eye for the light or vision, and ear for the sound. The life force is lost through the sensory indulgence, and this practice reverses the flow and conserving the energy. We have discussed in the previous sessions that youthfulness and prevention of disease is mainly dependent on conservation of energy. If you are able to perform Panchendriya meditation periodically, that results in conscious and unconscious conservation of energy, and excess of energy will result in youthfulness and disease prevention. We do meditation sequentially, like how we did today, from transformation of energy into pressure, taste, smell, light, and sound. It gives a kind of freedom from slavery to senses. Somebody who got very sweet tooth and have a lot of craving for sweet, or somebody who's got a lot of interest in music and indulging in music overzealously, they can come out of this kind of slavery behavior, and material consciousness is replaced by the spiritual consciousness. The other common meditation we perform is the Panchabhuta meditation, which also we have done in these Saturday sessions very frequently. It's a kind of elemental alchemy where we can say that we are not the universe and the universe is in us. It harmonizes the body's biomagnetism with the macrocosm, and we focus on the earth, which accepts the positive magnetic waves, water, fire, air, and akash. It gives a lot of immunity and protection from the environmental forces. For Panchabhuta meditation, it's nice if we know the 5 fingers association with 5 Panchabhutas, thumb with fire, and we can understand that because thumb is one of the main thing used for all the mudras, by we using the thumb as a fire to improve the other 4 Panchabhuta components. And the index finger is the air, and that's why in meditation the commonly used process of touching the index finger with the thumb, which improves the air circulation and pranic energy. Of all the 5 Panchabhutas, the predominant Panchabhuta is the space, and that's why the tallest finger is considered for space. The ring finger is considered for earth, that's why we wear the ring in the ring finger, that makes us grounding. And the little finger is for water, and that's why the children sometimes they show the finger to get permission to go to the toilet or urination, for example. If somebody doesn't believe these things, I can give them a very quick, maybe a minute or 2 exercise. Close your eyes and focus on your breathing. When you are focusing on your breathing, try to touch tip of your index finger, which is for air, with tip of your thumb. Maybe you can open and see what I'm showing like this. You can see immediately the breathing turns to the chest, which is the air component. If you want, you can release the finger, and then when you touch back, you will feel that the chest get predomination in breathing. If you focus your thumb to the ring finger, which is for earth, automatically the breathing changes to the tummy, because the tummy or the lower tummy especially is the chakras in relation to the earth. Do it at your own time. You will feel the magic of just changing the finger, touching the thumb, touching the index finger to the ring finger, changes the respiration pattern from your chest to the lower tummy. That shows how much these mudras and panchabhutas are quite vital and working in our body. And once you understand that, you will be getting a lot of interest in understanding these mudras and various mechanisms what Maharishi has given us. The other important meditation technique Maharishi has given us is the Navagraha technique, which results in celestial harmony, where the laws of mutation, where the laws of changes in our moods or changes in our economic and physical life, all governed by the Navagraham. We know that very well. Some of you may know your astrology boxes, and you will be also keeping a close eye of when the Sani Perchi happens, when the 7.5 years completes, etc. We focus not just on the planets, also on Sun, Moon, Rahu and Ketu. Even though in our Siddha technique we call everything as planets, we know scientifically we have planets, and Sun, Moon, Rahu, Ketu are not considered as planets. Objectively, Navagraha meditation aligns a personal frequency with the planetary magnetism. End of the day, that's what decides the Earth's magnetism, indirectly deciding every human magnetism. It neutralizes the negative energy and affects and boosts the organ health. And then we all know about this 9 center meditation, where we'll focus on the 9 centers, and all the 9 centers of correspondingly organs, especially the endocrine organs. And I am pretty sure in this elite group, most of you are quite well versed with that. Nityananda meditation is one of the meditation which we can do once you are quite good in the common methods of meditation. It's a kind of a cooling flame. Something equivalent to Nityananda meditation is also present in Tibetan practices, where because the Tibet being in the Himalayas and foothills of Himalayas, because of the cool climate, they use the Nityananda meditation to produce enough heat in the body. And you may have seen some videos of a wet blanket thrown into a sage in Himalayas, and the water literally evaporates. And Maharishi has given the Nityananda meditation as an exact counterpart of the cooling flame. It creates a ever blissful state where you inhale to raise the energy to the crown and exhale to spread the energy gently throughout the body up to the toes. In essence, we can even contemplate this with our Ojas breath during the Kayakalpa. And it gives a lot of cellular rejuvenation, anti-aging, blood pressure regulation, and it gives a kind of a persistent ecstasy and calmness and blissfulness. Apart from Turiya meditation, Turiyatita meditation is a bit higher level, where we consider it's like 12 inches above the crown, and it's something like homecoming of the soul. The soul is taken to its home. We can reach quite detailed frequencies like theta of 4 to 7 or even delta of 1 to 3 frequency in this. It is where we expand beyond the universal field of merge with absolute space, which is the Shivakalam. We discussed this absolute space in relation to Shivakalam. I think in the last few sessions I mentioned about the Shivakalam, Shaktikalam. Shaktikalam is where the activity is happening, while Shivakalam is the one, it's an absolute space without any activity but with boundless amount of energy. The main difference with Turiyam and Turiyatitam is Turiyam is merging with the life force, while Turiyatitam is merging with the God or the primordial force or the absolute space. Turiyam itself, as I said, will eradicate karma, while Turyatidam will takes us beyond the Sanchitam and Prarabdha karma also. So that really makes one completely in the blissful state even for the future births if somebody ends up having it. And the other one where a person can get good kind of contemplation with the God is the Irai Nilai Tavam, where we consider our sixth sense as a man with living beings, five elements, energy particles, and takes up to the absolute space. I think people should get into the Irai Tavam and the Turiyatita Tavam on the bit of a later aspect once they are well versed with the other meditation aspects. And we all know our Maharishi is one of the Maharishi or the master for the common man. And he always evolved the system to fit into the common man practice. So some practices like Manonmani Tavam, which is very specific with the pineal gland, were discontinued and contemplated or equated with the Turiya Tavam, and also other Tavams like Kavadi, lamp gazing, mirror gazing, and sun gazing were slightly discontinued here and there. But I know some of you may be still practicing lamp gazing and mirror gazing. The amount of good effects, if we properly follow the lamp gazing or mirror gazing, we can't explain even in the words. It gives us so much of biomagnetism and makes us understand the sole purpose of the life. And there are some various studies happen even with Sky Yoga. You may be quite surprised to know. This is one of the study which took place by using the first year medical students of Erode Medical College, published in 2025. And it was done over 24 months, where they measured the cortisol stress hormone from baseline to 24 months. You can see that there is a good drop in the cortisol levels from 19.9 to 17.6. And perceived stress score PSS also dropped from 24 to 14. And the blood pressure is also dropped from an average of 150/100 to 110/88. For somebody who is interested, I've collected all the articles for today. So this is a publication done purely on the Sky Yoga and on the medical students in the Erode Medical College, which is quite close to Aliar. And we can see the publication. It's quite a nice, detailed publication, and we should be quite proud to say that the Sky Yoga is also equivalent to various gold standard publications, which I'm going to share in the later part of my talk. And so we are speaking scientific and evidence-based. The divine dine-in starts with Agna meditation with good support from Shanti meditation, Turiya meditation, and Turiya Atita meditation. The final requirement is a master. It's very important. The Maharishi always stresses on the Sparisha Diksha, where a master should touch and give the initiation for the meditation. Nowadays, there are also lots of publications on the meditative practice outcomes are much better in people who do with a proper master, or at least in a kind of a hybrid setup, rather than just using the apps like, for example, Headspace, etc. And the biomagnetic transmission can't be learned in books. It should be felt in physical presence. Peace in the individual leads to the peace in the family, and we know peace in the society ultimately leads to peace in the world. So Maharishi's every step, whether it's meditation or Aindila Lavammurai or Maunam or introspection, not only give peace to individual, it leads to the world peace. And I will continue my talk focusing on more into science of the meditation. When you want to know a little bit more on the science of the meditation, how it works, absolute space, etc., the publications will take you slightly outside the Sky practices, but you can correlate quite quickly that it all grounded back to the same techniques. And the executive summary is it's a very systematic intervention. It improves the heart's function in a somatic manner. It improves the brain's function in a functional manner, and also mind function in a clinical manner. We're going to see the individual studies now. Overall, in the evidence-based world, the meditation is divided into like focused attention, where we are sustaining attention on a specific object. Like for example, if it is a Buddhist meditation, it is something like tip of the nose or breathing, Vipassana meditation. While in our Maharishi meditation, it can be Agna meditation, Turiya meditation, Turiyadita meditation, etc. There is another concept of open monitoring where somebody is not focusing on anything, but a non-judgmental awareness of the mental waves, somatic events, etc. It is slightly easier for somebody to start with open monitoring, and it gives a kind of decentering view that the thoughts are transient events rather than they actually belongs to us. Cardiovascular health, the European cardiology publication clearly showed that the stress, depression, anxiety are the main driver for morbidity, while mindfulness intervention results in good control of hypertension and also the ischemic changes in the body. When you see the cardiovascular outcomes assessed in various studies, there is a very good promising evidence on tobacco cessation and improving the ischemia in the heart, like decreasing the inflammatory burden and also improving the workload. There are some mixed reviews or outcomes in blood pressure and atherosclerosis outcome. And in the endothelial function as such, there is no big outcome, but we know that if somebody able to have a very stress-free life, non-inflammatory life, it should reduce the endothelial inflammation. This is one of the largest study on meditation. It's a meta-analysis involving 9,538 participants across 111 study published in Nature last year, 2025. It quite clearly given us that the mindfulness practice gives a very effective improvement, and the speed is not improved. You will become a very nice, calm performer with very good outcome, but the hurried performance is not that much improved. Like the p-value, which is used for statistical significance, somebody of you may be quite confident on the hedge G value. Hedge G value, whenever it is around 0.2, it is significant, while 0.6, 0.8 means it is like much more significantly helpful. So we can see that subjective cognitive functioning, working memory, which is equivalent to a computer's RAM, executive attention, where we can focus and do, for example, a clinic or a surgery or a driving or a presentation, and inhibition accuracy, where we inhibit from the autopilot mode and able to take care of our own journey in the day-to-day life. We can see the HG is quite significant around 0.2, which is the bare minimum. Of course, there are some limits. As I said, the meditation is not improving the speed, but it improves the accuracy of somebody's performance. End of the day, if you are able to accurately perform your techniques, the speed is only secondary. And it breaks the cycle of rumination. See, if you say historically, rumination is a very important thing. Say, for example, if in the forest dwelling human cohort, if there is a man went to hunt in a north direction and got eaten up by a tiger, the whole group will ruminate and feel bad for loss of that particular citizen, and that rumination gives them a kind of knowledge and re-imbibition that we should not go in that direction again for hunting. We should go possibly in different directions. So these kind of ruminations, background stress, and also known as default brain network, these things develop as a part of evolution to make a human being to live longer without a premature death due to a catastrophe or wildlife attack, etc. But we are not living in forest nowadays. We live in cities. What we ruminate? We'll ruminate about our spouse, some events. We'll ruminate about maybe mother-in-law's events or the manager's events. So the rumination is not useful. Instead of that, meditation results in statistically significant rumination reduction. Think about rumination, think about solution, act on the outcomes and produce some effect. And we can see that the standard mean deviation is very significant, not in one study, in 29 randomized control studies combined into a meta-analysis. And similarly, it is very effective than the usual treatment. The meditation gives you a very good standard median deviation, and it also gives a very sustained effect of reducing the rumination. How this mindfulness based cognitive treatment works, it literally rewires the mindfulness awareness techniques, disrupts the autopilot one, which I said. It decenters the perspective, like you are in the center. It makes you to observe your thoughts as transient events and not like facts, not succumbing to your own thoughts. And it gives a self compassion, which results in a very good escape route for self criticism. Because of compassion, the body inflammation comes down, blood pressure comes down, steroid secretions comes down. It gives a kind of peace and also gives a kind of space to improvement of self growth. The studies on depression and anxiety again showed a very good standard mean deviation, showing that significant alleviation of symptoms both in depression and anxiety. That's why the NICE guidelines, which is like the main guideline for the England, showed that it helps in preventing the recurrent depression episodes. It also helps in further reducing the worry, and it has a long-term durability. Coming to the baseline severity of the problems, we can see that the elevated psychiatric symptoms got nicely reduced, and the delivery method in person seems to be better than just online methods, which is what Maharishi also quite nicely expressed and stressed for a very long time. And unfortunately, if somebody is not getting these techniques quite early in the life, if they start quite late, the benefits are weaker. That's why Maharishi quite clearly says any boy or girl, once they reach the age of 14 to 16, they should have starting this meditation and also the Kayakalpa techniques. So the policy landscape, especially in UK perspective, is changing now. NICE guidelines in 2020 has recommended mindfulness as a very good option for mild depression and advised the mindfulness based cognitive treatment for relapse prevention. So rather than just saying like it is good, it is by our sages, it is by our siddhas, now we can speak very evidence based that there is a non-invasive alternative available compared to medicines and tablets. And even in a lot of workplaces, there are guidelines recommended for mindfulness within the mental well-being strategies. And the roadmap is primary care integration. The GP should be able to explain this at the root level for UK. In India, it could be any doctors where they should be aware of these kind of recommendations available and also the facilities available like our Sky centers. I'm pretty sure that the general practicing doctors in India, especially in Tamil Nadu, should aware of the neighboring Sky center, so that if a patient comes with this cognitive behavior problems or stress problems or even the physical problems like blood pressure, they are able to link to the Sky center so that things will augment and work better. And we should give targeted support to people who are suffering from pain, cancer, cardiovascular disease, addiction, etc. And we should be able to spread these things in the workplace environment, like for example industries where we can address large group of people in one sitting. So in conclusion, the meditation works by biopsychosocial asset. So it ticks all the boxes of brain getting trained for accuracy and executive control, mind getting nicely clinically intervened for prevention of rumination and avoiding depression, and body getting secondary prevention from blood pressure, atherosclerosis, and cardiovascular risk problems. There are lots of articles or publications in general in allopathic medicine. Say, for example, this meta-analysis on the effect of mindfulness meditation on self-reported introspective pain. Our Maharishi also explained introspection to a good level. He has a separate cohort of training for it, and it clearly showed that the introspection results in a kind of a self-awareness of knowing what is happening. The potential effects of meditation on age-related cognitive decline. This systematic review clearly proved that a good amount of meditation, especially when you are in that good, deep, theta stage or at least a delta stage will gives a good opportunity for good cerebrospinal fluid circulation. This results in clearance of the amyloid and prevents the cognitive decline due to problems like Alzheimer's disease or Parkinsonism. And Nature is one of the very highly rated journal, and we can see lots of neural mechanisms and mindfulness meditations were studied, and it bridges the consciousness and clinical outcomes with the neuroscience investigations. And there is a systematic review on even a cancer related pain where patients get a good amount of relief if they are able to do a good focused meditation, which results in endogenous endorphin and opioid secretion, so that they are not dependent on the exogenous opioid, which is quite dependent, and it can cause a kind of affection and results in long-term opioid abuse. So overall, we can see that mindfulness is very scientifically based, and it's the only way we can focus the mindfulness to get connection to the absolute space. By connecting to the absolute space, you will come across the divine feeling, which is not that spiritual, which is evidence based and can result in a very healthy, harmonious, long life. I'm quite happy for any questions.